to the shoulder.
Have extension and abduction.
Yes, extension, adduction, and internal rotation. So, because you're in this position, so my shoulder is an internal rotation, and then helps with adduction and extension. So it goes like this, so back. So you're like this. So imagine I'm laying down. If this is the table, I'm laying down. So what direction are you going to pull my arm out of? It's always the opposite of what it does. Yeah, so you can push them into flexion and kind of pull them into abduction. So if you're pulling my arm out like this. So into flexion, but also into abduction. So that's for latissimus dorsi, and that's a prone one. So let's talk about the sits muscles. So which one are external rotators?
There's minor and
Supraspinatus, teres minor, and infra. Yeah. So kind of nice because they kind of get grouped already. So supra, infra, teres, and this would be a internal rotator, the subscapularis. So supraspinatus, we went over this in special tests. How can you use specifically manual muscle test supraspinatus? Yeah, empty cat test. You have them in about 45 degrees of horizontal adduction, thumbs down, and then you push here. You'll learn in your evaluation techniques that when you're right here and you push here, sometimes it doesn't hurt, but it's fine. The athlete or patient doesn't feel anything. But when you move down the lever, it causes more pain. Why do you think that is?
Putting more force onto that area.
You're putting more strain because it's the closer you are to the joint, the more stable that it'll be, like the strongest it's going to be. But versus if you move along the chain, further you get out, it has to recruit more, like force to maintain that position. So a lot of the times people say, oh, I think I hurt my hamstring, but you test the hamstring. Did you guys learn how to test like medial hamstrings, lateral hamstring, like from the position prone? Well, when you're on your tummy and then you just pull down.
Yeah.
Whoa.
Like,
Internally and externally rotate in the direction of the pull. So, for example, if I'm like this, and then I tell you, okay, I want you to pull this heel towards my opposite hip, and then you pull them out, that's gonna get more medial, versus you say, oh, pull this heel towards this hip, and you pull down, you're gonna get more lateral. So, say you're right here, 90 degrees, that doesn't hurt. A lot of times it's not gonna hurt, especially if they're borderline, very mild. So you go down, so it goes from, say this is my leg, first 90, doesn't hurt, ow, that really hurts, that's the pain I feel all the time. So you wanna kind of go through the whole range, because sometimes when you're doing an evaluation, you're like, okay, you can't say, oh, this doesn't hurt, let's move on to the next one, it must not be a hamstring. But you have to really crank and do a stress test, especially when it's mild and it's not clear cut. So, supraspinatus, infraspinatus. So, in the book, you're prone. So, you're laying down. So, if this is the table, and plus, whenever the position, if you're testing, if it's special test, specific manual muscle test, you always want the shoulder right at the edge of the table. You want this to be able to have free motion, but the table is stabilizing the GH, or stabilizing this aspect, whether it's the scapula or this. Because when you're too far on the table, you can't get the true sense of motion or any resistance, versus when I'm on the table, if I'm right here, it's gonna have some blockage, but if I'm like right there, you could get motion, but you don't have accessory movement because the table's acting as your the table's acting as your stabilizer. So infra, you're in this position, but this is the table. And then you support right here, and since it's an external rotator, where is your pressure?
Pushing down.
Pushing down. Why are you pushing down? What is this making me do?
Internal.
Internally rotate, right? But it's an external rotator. Why am I pushing down? Yes. So she said that you push it in the opposite direction of what the muscle is, that initial action of the muscle, because it has to maintain that the action that it's used for. So just remember, if you're not sure, think about the muscle, think about what it does. Usually, if you're not really sure, but you know what the muscle does, and you may do the opposite, you could test, the strength of that muscle. So that's infra. Teres, you're on the table, and your arm, so there's a difference. So subscapularis and teres, you're all on your back. You're supine, and you're in this position. But the only difference is teres, you're a little bit abducted, about like 35 degrees. So like 30-ish, 35. And then if it's a external rotator, you're gonna put the pressure towards internal rotation, and you always want to stabilize at the elbow because you don't want accessory movement. So you always have two hands when you do specific manual muscle tests and special tests as well. Yes.
Since it's an external rotator, why couldn't you do that prone?
Because it's not going against gravity. Does that make sense? If you're laying up, external rotation for gravity.
But it is an external rotator, so as you're creating internal rotation.
Like while they're prone, you just put them up. Like, cause then you know how like cause in the infra we did it that way. It's just different position.
Okay.
So, because the thing is, when you guys do like group manual muscle tests, you know how you say, oh, does this hurt? Does this hurt for internal, external rotation? What you do is, this tells you which muscle group is injured. Flexion, extension, abduction. Then you go into the specifics. Okay, all the external rotators. So this is more infra, this is more teres, this is more supraspinatus. So you could differentiate between the muscles, even though they're all external rotators. Does that make sense?
Yes, but it still doesn't answer why you're not prone
Why you're not prone holding that position?
for teres.
If you look, okay, here's the picture. So you see how teres is, if you're prone, there's no way for you to really stabilize that.
Okay.
You know what I'm talking about?
Yeah, but then as you're testing external rotation and pulling them into internal, wouldn't they be going with gravity? In order to,
But you're testing them with gravity. Do you know, like you're pushing them into,
right, you're pushing them into internal rotation, but now they're using gravity
to go back?
to go back.
Yes. Technically.
If you're prone, they're externally rotating with gravity. If you're supine, you're externally rotating against gravity. So since it's a manual muscle test and you always have to work against gravity, you'd have to be, for the teres, supine, right? Because you're working against the gravity as you're externally rotating.
Yes. And it also depends on which book you use, or using this book. So there's so many ways to test.
So you
but
want that one from?
yeah, this one. And then the biggest difference is
I'm so confused now. Are we talking about the